Hello friends, welcome back to Friend of Health. So today in this video we'll be discussing about diathesis in Allen's keynote, different diathesis. So there are potential questions from this area. Almost all the question paper will have a question from diathesis. So UPSC question paper, recent question paper also, if you see, or the AIAPGET, there are questions about different diathesis. The exact line you have to by heart, and also compare all the diathesis remedies, because that itself can be a question. Like they can give 3 hemorrhagic diathesis remedy and 1 which is not from hemorrhagic diathesis, and they can ask which among the following is not a remedy in hemorrhagic diathesis, like that. So we will see all those in detail, like around 30 places you can see the word diathesis in Allen's keynote. Exactly, yeah, 30 places, different diathesis. We have summarized it in diathesis and medicine table also. But the thing is that if you see this summary table alone, you may not be able to recollect in the exam day when the question is asked. So exact line, exact symptom or sensation, or the exact thing is what Allen's keynote they will ask. So we will see one by one. So this video may go a little lengthy, but it will be worth it. So you invest your time and take a notebook or take a highlighter and pen and highlight in the Allen's keynote itself, and also note down the important things. And this study material will be uploaded in the course section of our Friend of Health app. Those students who purchase the Materia Medica PERFECT Revision course can get this study material PDF file for downloading. So this study materials which we upload will be of high yielding points. So if you are interested in Materia Medica Perfect Revision course, we'll give the link in the description box. And also if you download the app, you can see the link in the app itself for purchasing. So we will have live classes, recorded classes, and study materials and mind maps uploaded, and also revision test in a wonderful platform of Friend of Health app. So if you have not downloaded the app, you can do it today itself. So we'll go to the video. So diathesis in Allen's keynote. First diathesis itself is ammonium carb medicines. If you see hemorrhagic diathesis, fluid blood and degeneration of red blood corpuscles. Ulcerations tend to gangrene. Ammonium carb, hemorrhagic diathesis. So one remedy, the first remedy in Allen's keynote with a diathesis term mentioned is ammonium carb, hemorrhagic diathesis. Other main remedies in hemorrhagic diathesis you already know, like Crotalus horridus, phosphorus, ipecac, ferromet, all those. So we will come to that, the symptoms of that and presentation of that. So here the lines you have to forget, you should not forget, or the keywords are red blood corpuscles. It's not mentioned in many remedies. It's mentioned in very few places, or 1 or 2 places. So ammonium carb, degeneration of red blood corpuscles, fluid blood and hemorrhagic diathesis. These things you should remember. So Asterias rubens, the next one for the psychotic diathesis. So psychotic diathesis, that is also very important. Only 2 places you can see psychotic diathesis in Allen's keynote. That also will come to know next one, which is it. So stay with the video and watch the full video. Don't skip it. It is going to be worth it. We will discuss the previous questions also. So for the psychotic diathesis, flabby, lymphatic constitution, irritable temperament. So different temperaments, different constitution also are there. If possible, we will do videos on that. But this revision video is based on diathesis, because it is a very, very important area. So next is benzoic acidum, a gouty rheumatic diathesis engrafted on a gonorrheal or syphilitic patient. This is very, very important. Don't forget these keywords. This is not mentioned anywhere else in Allen's keynote. So gouty rheumatic diathesis, you can see many remedies like Rustox, Bionia, and other remedies are there, Ledampal. But engrafted on a gonorrheal or syphilitic patient, benzoic acidum, and other keynotes or other keywords of benzoic acid also you can remember, you can study. So that is very, very important. And Bryonia alba, next gouty or rheumatic diathesis remedy. It is best adapted to persons of a gouty or rheumatic diathesis. prone to so-called bilious attacks. So all these keywords, remember, bilious attacks, prone to so-called bilious attacks, Bryonia alba. So gouty or rheumatic diathesis. Next is capsicum annum. Capsicum annum phlegmatic diathesis. Very interesting. Only one remedy. Capsicum annum. Phlegmatic diathesis, lack of reactive force, especially with fat people, easily exhausted. So lack of reactive force. If a question comes and capsicum annum is there, go for it. So this can be a potential question. Phlegmatic diathesis itself is a question. So lack of reactive force. Don't forget this keyword of capsicum annum. Lack of reactive force. Chelidonium majus, old putrid spreading ulcers with a history of liver disease or of a tubercular diathesis. So liver disease, tubercular diathesis, old putrid spreading ulcers. So all these like points to Chelidonium majus, tubercular diathesis. Next is Colchicum autumnale, adapted to the rheumatic gouty diathesis. So again, gouty rheumatic diathesis. Persons of robust, vigorous constitution, diseases of old people. So bryonia, benzoic acid, colchicum. Till now we dealt with 3 remedies of gouty rheumatic diathesis, and the keyword of colchicum are robust, vigorous constitution, diseases of old people. And next remedy is Crotalus horridus, one of the prominent remedy for a hemorrhagic diathesis. Hemorrhagic diathesis, blood flows from eyes, ears, nose and every orifice of the body. Bloody sweat, that is the keyword of Crotalus horridus. If you see bloody sweat and it is a question based on Allen's keynote, go for Crotalus horridus. Hemorrhagic diathesis from every orifice of the body. Diphterinum. Next is diphterinum. One interesting diathesis, Strumus diathesis. You can say it is similar to scrofula or scrofulous diathesis, but again the name or term used is Strumus diathesis, especially adapted to the Strumus diathesis, scrofulous, soric or tuberculous persons, prone to catarrhal affections of throat and respiratory mucous membranes. So this is it, diphterinum, Strumus diathesis. We will see other Strumus diathesis and scrofulous diathesis remedies again. So this is diphterinum. Diphterinum, you have to understand that affections of throat, again you can remember it like that, diphtheria affects the throat. So affections of throat and respiratory mucous membranes, and the terms like Strumus diathesis, scrofulous, soric comes, this line will go for diphterinum. And the next one is Ferrum metallicum, one of the important hemorrhagic diathesis medicine. So hemorrhagic diathesis, blood bright red, coagulates easily. This is a keyword of Ferrum metallicum, coagulates easily. You have seen one of the characteristic of ammonium mure, blood is fluid blood and degeneration of red blood corpuscles. Hemorrhagic diathesis medicine, again you saw Crotalus horridus, blood flows from every orifice and blood is sweat. Here in Ferrum met, coagulates easily. Hemorrhagic diathesis, blood bright red and coagulates easily. These comparisons are very important. Ferrum force, ipecac, phosphorus. So they can ask a question like out of the following, blood coagulates easily in which one of the following medicines? Ferrum force, ipecac, phosphorus, Ferrum met will be there, and they will ask 1 and 2, 1 and 3, 1, 2, 3, 1, 2, 3, 4, like that. So this kind of multiple option question is possible whenever there is a 4 option answer or 4 medicines comparison or 3 medicines comparison. You should expect a question where multiple option question can be framed. So that's the way to study. And hemamylase, again a hemorrhagic diathesis remedy. So in hemamylase, if you see the its relationship part, it is written it is complementary to ferrum or ferrum. It's like ferrum is complementary. Yeah, ferrum is complementary in hemorrhages and hemorrhagic diathesis. So ferrum is complementary to hemamylase virginiana. If hemamylase was the complementary of ferrum, it will be written like complementary to ferrum. But here it is written complementary. The complementary remedy of hemamylase is ferrum. So ferrum is complementary to hemamylase in hemorrhages and hemorrhagic diathesis. So again one more hemorrhagic diathesis remedy, iodium. If you see persons of a scrofulous diathesis, again scrofulous diathesis with dark or black hair and eyes, a low cachetic condition with profound ability and great emaciation. Abrotanum can be compared here. So this is a keyword, a low cachetic condition with profound ability and great emaciation, and dark or black hair and eyes. Persons with scrofulous diathesis, iodum. So next again iodum, you have to compare some remedies for scrofulous affections like acetic acid, bromium, conium, calibic, spongia in membranous croup and croupy affections, especially in overgrown boys with scrofulous diathesis. So these are the remedies to be compared in overgrown boys with scrofulous diathesis. We have to compare with iodum, acetic acid, bromium, conium, calibic and spongia. So next is creosotum, another hemorrhagic diathesis remedy. Hemorrhagic diathesis, small wounds bleed profusely or freely, like bleed freely. So Crotalus auridus, lachesis, phosphorus again comes here. All this group you have to keep, like hemorrhagic diathesis you should keep in mind. Crotalus auridus, creosotum, then lachesis, phosphorus, ipecac, ferrum net, ferrum phos, all those remedies. So small wounds bleed freely, these are the remedies: creosotum, Crotalus auridus, lachesis and phosphorus. Flow passive in epistaxis, hemoptysis, hematuria. This is another keyword. They can ask a question. They can ask a question like flow passive in epistaxis, hemoptysis, hematuria. Creosotum is the answer. In typhoid, followed by great prostration, dark oozing after the extraction of a tooth. Another important symptom, practically also it is useful. Creosotum, hemamelis, after the extraction of a tooth. So after the extraction of a tooth, dark oozing, creosotum and hemamelis. Next, another hemorrhagic diathesis remedy is lachesis mutus. Hemorrhagic diathesis, small wounds bleed easily and profusely. Crotalus auridus, creosote, phosphorus. Blood dark, non-coagulable. Crotalus auridus and Sequel core. So another gouty and rheumatic diathesis remedy, ledampal. Adapted to the rheumatic gouty diathesis, constitutions abused by alcohol, such abused by mercury, abused by alcohol, such symptoms are very, very important. So constitutions abused by alcohol, two remedies, ledampal and colchicum. So rheumatic and gouty diathesis, you may be remembering the ledampal phase in brandy drinkers, etc. Phosphorus is the next remedy, very prominent remedy in hemorrhagic diathesis. So hemorrhagic diathesis, small wounds bleed profusely. Again it is repeating, creosotum, lachesis, phosphorus, it is repeating. So this same symptom. Whenever in Allen's keynote a same symptom is repeated, a potential question is there. So people can ask question by keeping all these options as multiple option, or one remedy which is not there in the list can be added, and they can ask which among the following is not a remedy for small wounds bleed profusely. Like that they can ask. So make it thorough. We have seen the same symptom in 3 places now. Small wounds bleed profusely. So hemorrhagic diathesis, one of the important symptoms, creosotum, lachesis and phosphorus from every mucous outlet, and like we saw in Crotalus auridus, like every mucous outlet or every orifice of the body. And next is phytolacca decandra, rheumatic diathesis remedy. Patients of a rheumatic diathesis, rheumatism of fibrous and periosteal tissue, mercurial or syphilitic. So patients of a rheumatic diathesis, rheumatism of fibrous and periosteal tissue, mercurial or syphilitic. So this is very important, rheumatism of fibrous and periosteal tissue, mercurial or syphilitic. So patients of rheumatic diathesis. And sorinum, next is about sorinum, soric diathesis. During pregnancy, this is a very recent MCQ about in UPSC 2020, this question was there. During pregnancy, most obstinate vomiting, fetus moves too violently when the best selected remedy fails to relieve. To correct the soric diathesis of the unborn, this was the question. To correct the soric diathesis of the unborn, remedies like sulfur will be there, all other soric remedies will be there. The answer will be sorinum. This was the question, recent question. So that is the way, this is the way how questions will be framed. To correct the soric diathesis of unborn, sorinum. So next is sorinum again. So hay fever appearing regularly every year the same day of the month with an asthmatic, soric or eczematous history. Patient should be treated the previous winter to eradicate the diathesis. So here he speaks about the psoriatic diathesis again, or the allergic diathesis, the hay fever diathesis, the eczematous, asthmatic, allergic or psoriatic diathesis again. So this is one symptom, actually very important question prone area. Patient should be treated the previous winter to eradicate the diathesis and prevent summer attack with which remedy according to Allen's keynote. So answer is Sorainum. This line you should keep in mind. And next is again Sorainum, one more diathesis question. Sorainum should not be given for psora or the psoriatic diathesis, but like every other remedy, upon a strict individualization, the totality of the symptoms, and then we realize its wonderful work. Similar one symptom we can see in aconite also. You can refer now itself about the importance of individualization. In aconite also a symptom is there. And rust oxycodendron. Next is rust ox, adapted to persons of a rheumatic diathesis. So again a rheumatic diathesis remedy. Rumex crispus for the tubercular diathesis, extremely sensitive skin and mucous membrane. So you can see the skin symptom or the modality of undressing, etc. if you see Rumex crispus. So it is a tubercular diathesis remedy. So this will help you in practical selection of the medicine also, this grouping the remedies under different diathesis or the main sphere of action of the remedy. So after you become a PG student or getting a medical officer post, by studying all these symptoms, don't think that these are useless. These are practically very useful. So next is the psychotic diathesis. Next remedy for psychotic diathesis, sarsaparilla for dark haired persons, lithic or psychotic diathesis. So this also is given, lithic diathesis or psychotic diathesis. Next is a very prominent hemorrhagic diathesis remedy, Sequel cornutum. So one more thing, psychotic diathesis you have seen in the beginning, Asterias rubens. Again it's coming in the sarsaparilla. So Sequel cor hemorrhagic diathesis, the slightest wound causes bleeding for weeks. We have seen this symptom 4 times now, including this. The slightest wound causes bleeding for weeks. So this kind of lines can come. Sequel cor, lacusis, phosphorus. Discharge of sanous liquid blood with a strong tendency to putrescence. Discharge of sanous blood. These are keywords which you will not find anywhere else. So these are very important. Such words are very important. Discharge of sanous liquid blood with a strong tendency to putrescence, tingling in the limbs and great debility, especially when the weakness is not caused by previous loss of fluids. So such symptoms are important. Hemorrhagic diathesis again. So next is Silesia terra, psoriatic diathesis. Apart from Sorainum, Silesia is also there with psoriatic diathesis, adapted to the nervous, irritable, sanguine temperament persons of a psoriatic diathesis. And Spigelia, adapted to anemic, debilitated subjects of rheumatic diathesis, to scrofulous children afflicted with ascarides, lumbricoids, Cinna's, Tannum and Spigelia. So ascarides, lumbricoids, 3 remedies by Allen's keynote, Cinna's, Tannum and Spigelia. So anemic, debilitated subjects of rheumatic diathesis, scrofulous children, so rheumatic diathesis, Spigelia. Next is Spongia tosta for the tubercular diathesis, direct line for the tubercular diathesis, Sulfur, don't think that when sulfur comes it will be given as psoriatic diathesis. Here it is different. Allen's keynote, adapted to persons of a scrofulous diathesis subject to venous congestion, especially of the portal system. So scrofulous diathesis, they give other remedies, means sulfur is there, means you don't think that it is not so, sulfur is not an answer. Sulfur is included in scrofulous diathesis. Keep that in mind. The last one, tuberculinum or basilinum, according to Allen's keynote, adapted to persons of light complexion, blue eyes, blonde in preference to brunette, tall, slim, flat, narrow chest, active and precocious mentally, weak physically, the tubercular diathesis. So these all things are important. These are previous question actually. So tubercular diathesis, tuberculinum, that alone should not be studied. You should study all these features: precocious mentally, weak physically. All these things they can come and they can ask which remedy. So tuberculinum will be the answer. So to conclude and to summarize, we will make it in a column. So diathesis, hemorrhagic diathesis, the important remedies in Allen's keynote are ammonium carb, crotalus, ferromate, hamamelis, creosotum, So before creosotum, ipecac also we can add HIJ, and ferrum force also we can add, as it is compared in a brackets. So ferrum force, ipecac also you should add in this list. And Lachesis mutus, phosphorus, CKL core. Psychotic diathesis, 2 remedies, Asterias rubens and Sarsaparilla. And gouty rheumatic diathesis also having many remedies like hemorrhagic diathesis, benzoic acidum, Bryonia alba, colchicum, autumnale, ledampal, Phytolacca decantera, Rustoxicodendron and Spigelia, 7 remedies. And phlegmatic diathesis, Capsicum annum, only one remedy. So from diathesis, this is a potential question because only one remedy is there. Phlegmatic diathesis, Capsicum annum. And tubercular diathesis, Chelidonium majus, Rumex crispus, Spongia tosta, Tuberculinum bacillinum. And strumous diathesis or Scophilus diathesis, if you group them together, diphtherinum, iodum and sulfur. Soric diathesis, 2 remedies, Soranum and Silesia terra. So you may find a phlegmatic word in different places of Allen's keynote, but as a together as a line, directly it is given phlegmatic diathesis only in Capsicum annum, and all these things, Scophilus diathesis, Soric diathesis is given only here. So this is the summary table. So if you want more similar content like this video, revision, important revision points or important high yield points, you can purchase the course from Front of Health app. The link will be given in description. Materia Medica Perfect Revision course is going on with live classes and recorded classes and study materials and mind maps, etc. and discussions. All the best wishes for everyone for AIAPGET 2021 especially, and other state PSCs coming up. So best wishes once again.